Oral surgery, becoming an oral musculofacial surgeon. That's what's on tap because we just got someone who matched in the oral surgery program where it's been a process that's been 5 years in the making. Stay tuned as we talk to a dental student who just matched in oral surgery. Stay tuned. Hey, this is Dr. Darwin, a new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, surviving dental school, getting into residency, and then life as a new dentist. Guys, be sure that you continue to like, subscribe, but most importantly, share and comment on the content. Sharing is caring, and we want to hear your get some feedback on the information that you're receiving on a weekly basis. Also, this episode of Ask Dr. Darwin is being brought to you by GetIntoDentalResidency.com. Right here, GetIntoDentalResidency.com. Check it out. It's the ultimate resource to help you get into the residency program and the specialty of your dreams. Not now, but right now, this cycle. Go check it out. Go down, check it out for more details. So the details that we're talking about today is about oral surgery, right?
Yes,
and we're joined with a fourth-year dental student who just matched, and we're going to be talking about why oral surgery, how he prepared for his applications, the schools that he applied to, the interview, and his rank list, but also most importantly, the advice. So guys, be sure to stay through all the way through. All right, stay all the way through because you don't want to miss some hidden gems that will be available for you to help you get into oral surgery as well. So today we're joined with student doctor, soon to be officially DDS, Marcus Clayton. How you doing, man?
I'm doing well. How are you doing, sir?
Man, hey, not as good as you. Not as good as you with your recent success and matching. So congratulations first and foremost. And you know what? Let's open it up since we're stirring it up and we're brushing it up here today. Let's just have, if you would, just introduce yourself for those that are meeting you for the first time.
Well, my name is Marcus Creighton. Like you said, I'm a fourth-year dental student at Meharry Medical College, located in Nashville, Tennessee, and I am from Chicago, Illinois. I attended Fisk University, which is located directly across the street from the School of Dentistry at Meharry, which kind of just led to my matriculation. And I'm happy to be here, offering advice to any future oral surgeons out there.
Yeah, it's going to be advice. It's going to be a jam-packed episode. So guys, make sure that as you're listening and watching, take notes and then go back to the recording, right? Go back and listen to this as well. So let's kick it off, man. Why oral surgery? Why oral surgery? I mean, there's a lot of other disciplines, pedo, endo, general dentistry, pros, perio. Why did you decide oral surgery?
Well, oral surgery sparked my interest when I was in the process of applying to dental school. I shadowed an oral surgeon here in Nashville at TriStar Health, which is a level 2 trauma center here in Nashville. And I really enjoyed how the doctor was able to anesthetize the patient, put them to sleep and do the procedure at the same time. I've never seen anything like that. And then when I began my post-baccalaureate master's in health science program at Meharry, I took a gross anatomy course, which really just intrigued me with the anatomy of the maxillofacial region. And from there, I started to reach out to continue to shadow the doctor that I was shadowing and just to learn more about the specialty itself. Oral surgery, it's different from any other specialty where they do so many different things. You're not just doing the same procedures. And what really intrigued me the most, besides being able to anesthetize and put patients to sleep, is the maxillofacial trauma, the reconstructive aspect of it, where you really create a whole new appearance for a patient. And that's really why I wanted to be an oral surgeon.
Yeah, that life-changing reconstruction part, in addition to those that have trauma, uh, implants, different type of surgery, in conjunction also with orthodontists doing some orthognathic surgery and stuff is usually one of the entrance uh, points of interest for many people who are considering. But I would tell you, man, oral surgery is no joke, no joke. And so you thought you were pledging in dental school. You really gonna be pledging now.
Yeah, my first time being in the OR, it felt like being online again. That's for sure.
Yeah,
You're in the OR standing for a long time sometimes, and things don't necessarily go the way that it was drafted up to be.
that's right.
Sometimes the bone doesn't fixate where it's lock in with the screws. It's a lot, but
Yeah, yeah.
my first time where I scrubbed in for a pan facial fracture, which was close to about a 9-hour procedure. Just being able to see the before and after of that patient, and how all of his fractures were fixated, and after the swelling went down, it was like, wow, this is really something cool to be able to do for the patient.
Yeah, yeah. Well, let's talk about, how you are able how to get to becoming an oral surgery resident, right? Because it's a process, just like
Yeah.
everything else. So let's talk about the application because, as we know, for residency for oral surgery, it's a little bit different. Meaning, there's typically a big exam that people that programs want you to be able to demonstrate and have a mastery of as part of your application. So let's talk about that as it relates to your overall application and how you prepared, how you went about, because it seems like you pretty much knew 5 years ago or surgery. This is what I want to do. So that means that to get to the end, you got to kind of reverse engineer and go back so that you know where to start so that your steps lead up to where you are right now. So talk a little bit about that process and how you started to put your application together.
Well, it really started from the first week of dental school, where we had an orientation for all the different departments at Meharry. And Dr. Perkins Davis, who is the chairman of the oral surgery department at Meharry, I went and spoke to her immediately after she spoke to our class. And, I told her, I was like, hey, Dr. Perkins, I'm trying to be an oral surgeon. Like, what do I have to do? And the first thing she told me was, you get your grades up. Like, you want to have your grades as high as possible. And so that was really my goal. First year of dental school was just to make as many A's as possible on my transcript. Um, and after my grades were high after the end of first year, I came back to her and I said, well, my grades are pretty high now. Like, what do I need to be doing now? And then she told me I need to start studying for the CBSE exam, the Comprehensive Basic Science exam, which is similar to the medical step 1 exam that medical students take. And in my second year, she also said that I needed to start to shadow oral surgeons just to see what the full scope of oral surgery is like, because it's more than just taking out teeth. And I spent my second year studying for the CBSE and shadowing, and also making sure that my grades didn't slip, because my class rank played a very important role into my application. The CBSE is a very hard exam. I had to take it more than once, and every time I took the exam, I continued to improve. And once I had the score that I needed, my third year, she told me that I needed to, keep my grades up, spend as much time in the oral surgery clinic as possible on campus, because during that time that's when the pandemic was going on, and so I had to make some adjustments to my application process, to my application and preparing for that cycle, because there were certain programs that would typically offer externships that weren't offering externships at that time. So I had to use the make the most out of my opportunities. So I spent a lot of time in the oral surgery clinic. There was another one of my mentors who had a private office that was right down the street from a hearing. On days that I had independent study, where I had a 2 or 3 hour break, I would go and shadow him and just ask as many questions as I can, be engaged, trying to learn something every time that I went and shadowed. And from that just matriculated to my 4th year of having not only the grades, but also having private practice experience in the process of ending my 3rd year and beginning my 4th year. I was reaching out to do as many in-person externship that was out there at that time. I remember my first externship I did at University of Tennessee in Memphis at the Elvis Presley Memorial Center, which is a level 1 trauma center. And I knew that I wanted to be at a level 1 trauma center ever since my 2nd year, where there was this presentation on oral surgery that talked about all these different facial fractures and orthodontic surgeries that just really interest me. And I knew that I wanted to spend a lot of time getting that training at a program that deals with a lot of trauma. And so applying to a level 1 trauma center was my number 1 goal. And so all the externships that I did, besides the one that I did at Meharry, were all at level 1 trauma centers. A tip for those that are applying for externships: try to not only do externships at programs that you're interested in, but also ones that won't be such a burden on your pockets. So I knew that I'm from Chicago and I have a lot of family in Chicago. So I went to Chicago to do an externship at Cook County Hospital. So I just had to get to Chicago. I was able to not avoid paying for not a hospital, but a hotel and renting a car, because I was able to get around with my friends and family, as opposed to trying to go to Texas or a state where I would have to not only pay for airfare, hotel, and it can be really expensive, along with these applications. So
it adds up real fast. It adds up real fast. So it seems like, one of the things that really helped you through your application as part of your process is grades,
great.
externships, staying connected with a faculty member, and better yet, the program director of the oral surgery residency program, to get those tips and those guidance, but also preparing for the exam, because I know for a lot of people that's the thing, that exam, that preparation for the exam. And I can't recall if there's like a prep course for the
Yes.
CBSE.
Yeah.
You want to talk about that? I think that would be.
So for preparing for the CBSE, a lot of people recommend Pathoma, which is it's a series of videos that give you a full scope on anything that they can ask you. Pathoma is very important. I use another program called Sketchy Micro and Sketchy Farm, which give animated pictures that everything in the sketch means something, that I hope you just retain certain concepts for the exam. So Sketchy Micro, Sketchy Farm, and UWorld. UWorld is the question bank that I strongly recommend that you do, but not only do once, but try to do it as many times as you can, because it does a really good job of breaking down what each answer choice is and why it's the wrong answer and why this is the correct answer. And so I really use UWorld a lot. And to help retain the knowledge, there is a computer flashcard based system called Anki, spelled Anki. And through this program, it helped me to retain the pharmacology and the micro that I was watching in these videos, because it's so much information and they can just ask you anything. By doing questions on UWorld and doing these flashcards to help just lock it into my brain. Those are things that really just help me to prepare and to do well on the
Yeah.
CBS.
Yeah, that CBSE is a monster, man, from what I keep hearing. And these four resources is a straight pathway to getting you prepared. So thanks for sharing those, because that's usually the is one of the things that causes a gap for a lot of people who are applying to oral surgery, especially if it's a little bit later than earlier in your application cycle, especially if you're waiting to do it, maybe your third or fourth year, because I think you can take it just about any time.
You can take it anytime, and I
Right.
really recommend that you take it your second year.
Yep.
Take
Yep.
it as early as possible, because the first time I took it, I really didn't know what I was dealing with, and how big of a monster this exam was, and
Mhm.
um, I didn't get the score that I needed until my third year, and that's one of the things that my mentor stressed upon. Like, she was like, take it early, you know, like if you don't feel like you're ready, still take it anyway. Like,
Yep.
you need to get an understanding of what you're dealing with.
Yeah. And for those that are watching and listening, best believe, like the DAT, the CBSE is a measuring rod that's you that's used to screen applicants, right? They use that. This exam was specifically and uniquely created for oral surgery and for applications and for candidates. So, um, like was mentioned, you want to do well on that exam, because that will open the door to the next phase of your application, which is the invitations for interviews. Which leads us to our next question, which deals with interviews. But before you have interviews, you have to come up with a list of schools, right? A list of schools or a list of programs. So tell us a little bit about your process on selecting schools, and how you went about uh, those putting those schools on your list.
Well, I knew I wanted to be at a level one trauma center, and I wanted to be at a 4-year program. And so all the schools and programs that I applied to were all 4-year programs. And I applied to as many level one trauma centers as I could afford to. I submitted over about 30 applications, just to give myself a broad scope. I want to throw out a large fish net. Just I want to maximize my opportunity, because it's a very competitive cycle. Most programs only offer two positions. Some offer 3. Some even offer just 1 slot. So I wanted to make the most out of my opportunity. With my application, I broke it up into pieces. I started off with my CV, making sure that my CV was in order. I had multiple people look at my CV, make sure that it was formatted right. Everything that needed to be on there was on there, because sometimes people put things on their CV that doesn't need to be on there. Um, like so, as it was the score, then it was the CV, then it was my personal statement. Um, but another thing that's really important is who you have vouching for you, who's writing your letters. If you're applying to oral surgery and you have an endodontist, an orthodontist, and a general dentist writing your letters, it's not going to weigh the same as the oral surgeons from your school, your department chair, and those who you shadowed in private office. Oral surgeons want to hear from other oral surgeons about who they are trying to offer a position to in their program.
That's an important tip. Important tip. Oral surgeries uh, programs want to hear from other oral surgeons, right? That's their peer group. That's the folks and the colleagues that they want to hear from, as it relates to your candidacy. So very important. So 30 programs, and you knew level one trauma is a must, and 4-year program is a second must.
Yes.
So let's talk about though the next step, which is interviews, right? Because last time I checked, the only way you get into a program is you got to interview, right?
Yes,
You
sir.
got to interview. So let's talk about the interviews that you received based on those 30 applications, and let's talk about what how the interview day was, because I've heard stories, whether it's oral surgery, pedo, but sometimes there's some case scenarios. So what would you do type of interview questions
Yes.
that people need to be prepared for. So share with us a little bit more about that.
Well, each interview it varied. Some were very chill. They just asked about me, asked about my experience. Um, but there are some that gave case based scenarios. How would you resolve this conflict? How would you extract this tooth? What is Ludwig's angina? How do you treat that? There, it's a few of those I got, but the main questions that they asked were standard interview questions. Tell us about yourself. Why oral surgery? Why this program? Strength and weaknesses. They'll ask you to elaborate on what you have seen, and why did they go about how they did in the surgery. What are some things that you learned from that surgery? And that's when those externships really come in handy, because if all you've seen is teeth being taken out, then you really have not barely scratched the surface at all about what oral surgery is about. And so just being able to talk intelligently about what the surgeries that you have seen, the different cases being on call. They want to know that you have an idea of what it's like to be a resident, because it's long hours, and when you're in the OR, you're not just leaving and going to get coffee. It's when lunchtime hits, we are in this surgery and we got to figure this out right now. And so just being able to talk intelligently about what you have seen, and your experiences really help you out a lot. For me personally, what I did to prepare for my interviews, I wrote out some questions that I would be expected to ask, that they would ask me, so that when they'd ask me, I would be able to, give them a response. Some of them I didn't have responses for, but most of them I did have responses for. And I think that really just helped. Doing mock interviews is very important. I did not get a chance to do a mock interview, but I did my first interview was with Meharry, and I personally don't think that was my best interview. But from that experience that I had, I was able to reformate some. If they ask me this question, somebody else asked me something similar to this again, I'm going to have a stronger response
Right.
for it, and that just really just helped me throughout my interviews.
Yeah,
And
and
so
that's
if you
key.
can,
And that's key, that to take those lessons learned from the interviews to prepare you for the next one.
yes.
Yeah.
So if you can get somebody to do a mock interview with you, if you can get one of your attendings from the oral surgery department, or the chairman or whoever that will sit down with you and give you some pointers on what to say and what they're looking for, it will really help you.
Yeah, and again, the value of doing those mock interviews is the value of having that experience uh makes you more prepared, because you only get one chance, one opportunity in the interview to make your best impression.
Sometimes just 15 minutes.
15 minutes, and it starts immediately. So I'm glad you mentioned mock interviews, because a quick plug, get into dentalresidency.com. That's one of the services that we provide to help you prepare, do a deep dive into your programs, but also practice talking about yourself, about your experiences, and relating it to the program. And there's a science and a technique and technology of being able to do that. So you're right. You want to make sure that you practice and have some mock interviews, and we can help you with that as well. So you had interviews. How many interviews were you able to lock
I
in?
interviewed at eight institutions, eight
Wow, that's
programs.
great. That's great, man. That's awesome. About one third, or a little bit more than a third. Um, about a fourth year program, a little less than a third. That's great. So after the interviews, sometimes what happens is the program that was number one or in your top five, sometimes they move around, right? They start shifting. Four becomes two, two becomes one becomes three, and that's just based on the feedback and the vibe of the interview once you've got a chance to meet people in person. Tell us a little bit about, you mentioned the two things that were most important to you as far as looking for schools and applying to programs, which was um, uh, 4 year program, and then you also mentioned that it had to be a level one trauma. After you did your interviews, what helped you come up with your list, your rank list? What were some of the things that were really or mostly important to you that influenced how you ranked those 8 programs that you had interviews with?
Well, they were all 4 year programs, but I started off with, which ones are level one trauma centers. And then out of those, formulated on where I wanted to be. Um, I typically didn't do my application process according to what some people say. Some people say apply to the program and not the city. I I've been in Nashville for so long. I was really trying to leave Tennessee. I wanted to get back to a metropolitan area, and I believe that Howard was such a good fit for me because not only is it a level one trauma center and it's a 4 year program, but it's in a metropolitan area. It's in DC, and so I just thought that was a perfect fit for me. And so that was a little bit higher up on my list compared to some other programs, but not every program allowed for students to have in-person interviews, and so that also played a role into my where how I ranked because I was a little afraid of not not liking my environment, and it's really hard to fill the room out and fill out how this next 4 years is going to be in such a short period of time. But my interview with Howard went so well that I put them in my top three. Um, another program that I interviewed at was Nova Southeastern University, and that was an in-person interview. That was my first time ever being in Florida, and I was like, "Wow, this is nice." And so I also had them in my top three as well. And the last school that was in my top three was Emory University. But see, the thing about with Emory, I only put it as high because of the establishment and the opportunities that the program was offering. But my interview was just so short. I just really didn't know how to fill them out. So I actually had them a little lower than Howard because I was kind of unsure about where like how this could turn out because I have some friends of mine who are in great programs, but they're not as happy as they are in those programs.
Yeah,
And I just made sure that I was at a program that would be a good fit for me.
that's key, and that's why that in-person interview and being able to network and find people that are at the programs is key because you have to fit into the program, meaning the program's got to be a fit for you. Because at the end of the day, you can get into all 8 programs, right?
Yeah.
But if it ain't gonna work for you, guess what? It ain't gonna work. You're gonna have a miserable experience. You're gonna be somewhere in a city that maybe you don't want to be in. You're gonna be in a program that you don't know enough about because you maybe haven't had a chance to talk to the residents, get their feedback, get their vibe, and that's important, especially if you're gonna be there for 4 more years.
Yeah.
That's a lot of days. If you do the math, that's a lot of days.
A lot of days.
Over 1,400 days. That's a lot of days. And it's not like it's a 9 to 5 day either. It is not a 9 to 5 day. It's on
Uh,
weekends and it's late night, like you said, when you go into the OR and being on call. So you want to make sure that you get the vibe that you need because when you go for interviews, yeah, they're interviewing you, but guess what? You are interviewing them as well because that's going to be your home. So it's got to be a fit for you. So I heard Howard, I heard Nova Southeastern, I heard Emory. And you know what? Back in the day, I think they had a dental school at Emory. Then that was the other school in Georgia back in the day, I think.
but
Um, yeah.
I've also interviewed at Detroit Mercy,
Hmm.
Brookdale Medical Center in Brooklyn, Woodhull Hospital in Brooklyn,
Yep.
Harlem Hospital in Harlem, New York,
Yep.
and I also interviewed at Meharry. Those were my 8 programs that I interviewed
Yeah.
with.
Well, all great programs, man. From Detroit to East Coast, New York, all the way down to Florida. But now we need to know. We need to know where you're going to be taking your oral surgery talents to in July. So drum roll. Where's the drum roll? Well, I guess everybody off today. I got to do my own drum roll. Drum roll. Where you going to be going to do
On
your
the
oral
clock.
surgery?
I will be going to Howard University Hospital in Washington, D.C. Looking
HU.
forward to it.
Congratulations, man. That's awesome. Chocolate City. Chocolate City with a whole
I
bunch of
didn't,
other sprinkles now.
yeah, I didn't realize that's what DC was called that until after I matched. Everybody was like, "Oh, welcome to Chocolate City." I was like,
Yeah.
"Yeah."
Yeah. Well, you got to put a little asterisk on it now because it's Chocolate City. It's a whole bunch of other stuff. Chocolate, vanilla, green sprinkles, red sprinkles, a whole bunch of sprinkles going on in DC now, especially in the Howard area. But congratulations, man. That's great. I'm gonna connect you with a couple former residents that is actually that have completed the program. He was a chief resident, and the current chief resident that's at Howard went to Rutgers, and we've been connected since his third year at dental school at Rutgers. So it's been 4 plus 3, 2. So that's 6 years. So we'll get you connected with him as well because Howard has a great longstanding tradition of putting out some really awesome oral surgeries, man. Oral surgery residents and oral surgeons, board certified oral surgeons at that. So that's cool. So knowing what you know now, and we're going to move to the next question. Knowing what you know now, what's some advice and some tips that you would want to share with those candidates that are considering and we already know, like you knew, that they want to become an oral surgeon? Give us like 3 or 4 things.
Well, one of the important things for interviewing that I can give, and I did not make this mistake, but this was kind of a I don't want to say a trap, but this is something that they will throw out in an interview. They will ask you some questions that they won't expect you to know. Everything that they ask you, they're not necessarily asking for an answer back. They want to just see what you know, and it's important to not try to how can I put this? Don't lie. Don't try to make up an answer. If when they ask you a question, especially if it's something related to surgery, they already know the answer, and so it's important to let them know, like, I have to read up on this. I'm not exactly sure. And then every time that I said that, they would always say, "Oh, we really didn't expect you to know that. I just wanted to see how you would answer." Um, and um, it's it's important to with the externships to talk to the program directors while you're there at those externships. When I externed at every place that I did, I always found 5 to 10 minutes before I left, before my last day there, to sit down with the program director. Ask them what they're looking for in an applicant, things that they look for on applications. What is their idea of a strong candidate? And I kept all these things in mind when I was formulating my application. Um, it's also really important for you to um, to be yourself. Don't try to um, be somebody else on that interview day. I knew that for myself. I knew that I was a well-rounded applicant because I'm into a lot of different things. I've got football and basketball. I've been football and baseball up here, but I'm also a reader. And some of these things kind of help break the ice, especially on some virtual interviews with people, because they're looking for somebody that doesn't also just do school all day. They're looking for a well-rounded applicant, somebody that they can get along with, because it's been several times where program directors have told me that just because you have high grades and high CBSE score, you come in here and you take this interview for granted that it's not going to go well. The match will not be in your favor. And so it's important to remain humble throughout this entire experience, and to, when you're on these externships, to make the most out of your opportunities. Spend as much time in the OR as possible. You can spend all the time at your dental school, extracting teeth and watching teeth being taken out. You want to get what you can't get at your dental school at these externships. So if you have the opportunity to go and be in the OR all day, you need to be in the OR all day.
A great point. You got to maximize that time, because you don't get that time back doing an externship as well. So I would tell you, man, this time spent and hearing how you matched into oral surgery has been helpful. What's the best way for people to get in contact with you if they have some other questions or just want to reach out to you? What's the best way?
My email is marcus.creighton82@gmail.com.
There you go, guys, right up there. Get in contact with Dr. Marcus, and he's going to help yourself get into oral surgery if you have some other questions. But you got to catch him soon, because July 1st is going to be here very soon. And he's not going to have a lot of time, because his time is going to be preoccupied as a first-year oral surgery resident. What does that mean? That means his 24 hours a day are going to be busy 25 hours of those 24 hours. And that's just the reality. But also the reality is we really appreciate your time you spent with us today, sharing with us how to match into oral surgery. So this has been helpful. Guys, also check out these videos here. Hopefully these are helpful for you as well. And that's our time. Love, peace, and smiles. We'll see you next week. Next video, next week. Thank you.